Hi, my name is Carrie Olson. I'm the lead social worker at Pascack Valley Medical Center, and I'm here today to talk to you about substance abuse and addiction. Whether someone has a problem with alcohol, opioids, or other substances, addiction kills thousands of Americans every year and impacts millions of lives. Addiction is a mental disorder in which someone is compelled to engage in certain behaviors even though they have harmful consequences. Addiction destroys marriages, friendship, careers, and threatens a person's basic health and safety. Many factors contribute to someone developing an addiction. While genetics account for 40-60% of a person's risk of addiction, one's environment and the impact of that environment on gene expression increases a person's risk of addiction. Environmental risk factors include a chaotic home environment and abuse, parents' drug use and attitude toward drugs, peer influences, community attitudes towards drugs, and poor academic achievement. Drug misuse, abuse, and addiction are all serious public health challenges. Since all of these deal with the use of illegal drugs and inappropriate use of legal drugs, tobacco, alcohol, or prescription medication, a lot of people commonly use these terms interchangeably. However, the interventions for each greatly vary, and correctly identifying the issue is crucial in getting to the most effective treatment. What is drug misuse? Drug misuse is generally associated with prescription medications, which are meant to be taken as directed by physicians. These types of drugs can cause adverse side effects if not taken as prescribed. Drug misuse happens when substances are taken for purposes that are not consistent or legal with medication guidelines. Examples include taking the incorrect dose, taking the drug at the wrong time, forgetting to take a dose, stopping the use of the drug too soon, having the drug for reasons other than why they're prescribed, or taking a drug that is not prescribed to you. What is drug abuse? Drug abuse happens when drugs, including alcohol, illicit drugs, or any psychoactive substances, are misused to get high or inflict self-harm. It's also known as substance use disorder, or SUD, since people who abuse drugs experience significantly altered thinking, behavior, and body functions. So what is drug addiction? Drug addiction, also known as severe SUD, is a brain disorder that manifests as the uncontrollable use of a substance despite its consequences. People with drug addiction have physical and/or psychological needs to take a substance because they suffer intense or debilitating withdrawal symptoms if they go without that substance. How is drug misuse different from abuse? The key difference between misuse and abuse is intent. Misuse is used to treat a specific ailment, whereas abuse is when a drug is taken to elicit certain feelings. For example, drug misuse is when you take a second sleeping pill if you can't fall asleep after taking the first. But abuse would be if you were taking that medication or that pill to catch a buzz. How is drug abuse different from drug addiction? Drug addiction is a severe form of drug abuse. The distinction lies in how much control the user can exercise over themselves. Since a person who abuses drugs still has control, they don't experience major disruptions in their lives. In contrast, those with an addiction have a disorder that affects most, if not all, aspects of their lives. They often miss work or school, endanger their families physically and/or financially, suffer health problems, get into legal trouble, and other serious issues because of their substance use. But despite these, they are unable to change or stop their behavior. There are some common myths about substance use disorders. One of the myths is willpower is all one needs to beat addiction. In reality, prolonged substance abuse alters the way the brain works. The brain sends signals of powerful and intense cravings, which are accompanied by compulsion to use. These brain changes make it extremely difficult to change the behavior. Another myth is that you have to hit rock bottom before you can get help. Recovery can begin at any time. Given the impact on the brain and the possible consequences of using, the earlier one can get treatment, the better. The longer it continues, the harder it becomes to treat, so waiting for a low point is unnecessary. Another myth is if someone relapses, they're a lost cause. But in reality, try not to be too discouraged by a relapse, which is a recurrence of symptoms. Addiction is a chronic illness very similar to type 2 diabetes or hypertension, meaning it requires lifelong management. Relapse is no more likely with addiction than it is with these other chronic illnesses. Getting well involves changing deeply embedded behaviors, and this takes time and effort and sometimes results in setbacks. This doesn't mean that previous treatments failed, because the person with the disease still made progress overall in getting well. A recurrence may be a sign that the treatment approach or other supports need to change, or that other treatment methods are needed. There is hope. Keep in mind that most people with addictions who suffer a recurrence will return to recovery. The myth that prescription drugs are not addictive like street drugs because they come from a doctor. In reality, addiction to prescription medications, including painkillers, sedatives, and stimulants, is a serious and growing problem among all age groups. These drugs can be highly addictive and have serious harmful effects. Even if these drugs are prescribed by your physician, you may be at risk. If you're concerned that you may be suffering from an addiction, there are some questions that you can ask yourself. Are you experiencing cravings for the substance, the act of using, or the act of being impaired or affected? Are you thinking about using in the forefront of your mind a lot of the time? Have you ever felt like you should cut back on your use of the substance? Are you hiding how much or what you are using from anyone close to you? Do you feel shame or guilt around your using? Are you drinking or using alone regularly? Is this in any way controlling your life or your schedule? Do you find yourself using more heavily based on your emotions or stress levels? Have friends or family expressed concern towards your habits? Has there ever been a time that you've tried to quit or promised yourself that you would stop, but you could not manage to do so for more than a couple of days? Does using affect your personal life in any way, such as missing work or having arguments with people? Have you ever wondered what your life would look like if you did not use? Have you been in trouble with the law while under the influence? Do you become a different person when you use, such as a daredevil, or angry, violent, or even more extroverted? Do you compromise on your morals or values while using? And finally, do you experience any type of withdrawal symptoms, such as shaking, anxiety, depression, or vomiting in the morning when you don't use for a couple of days? If you feel that you have a substance abuse or addiction problem, there is help available. It is important to reach out or call your physician or seek out other professional help. Quitting suddenly or abruptly or cold turkey carries very significant risks, especially if the drug you are discontinuing is alcohol, benzodiazepine, or opiate. If you've been using any drug in any large amounts for any length of time, you may be suffering from extreme withdrawal symptoms. If you experience withdrawal symptoms, seek help at the nearest emergency room or contact an accredited detox center. You'll find links to resources at the end of this presentation.